Has the healthcare system ever been stretched this thin? And what role does the JN.1 variant play in this current predicament? Let's dive into it. The rise in COVID-19 cases has been dramatic, to say the least. We've seen a surge from less than 1% of cases attributed to the JN.1 variant at the start of November to a staggering 29% now. This sharp increase has led to over 23,000 new hospital admissions in the week, ending December 9th. That's the fifth consecutive week numbers have risen, hitting the highest levels we've seen since February. But COVID-19 isn't the only culprit. We're also seeing a rise in flu hospitalizations. The number of new admissions reached 7,090 for the week ending December 9th, up from 5,816 the previous week. The Centers for Disease Control and Prevention, or CDC, forecasts up to 18,000 hospital admissions due to flu are likely to be reported in the last week of December. And then there's respiratory syncytial virus, or RSV. States like Louisiana, South Carolina, and New Mexico are experiencing very high levels of respiratory illness. In the week ending December 9th, the rate of RSV hospitalizations was 2.3 per 100,000 people, a noticeable increase compared to this time last year. This confluence of illnesses is straining our hospitals. In fact, some areas are already reporting hospital beds for children nearly as full as they were this time last year. If these trends continue, the situation at the end of this month could further strain emergency departments and hospitals. Moreover, we've seen a sharp increase in emergency room visits, particularly among school-aged children, primarily due to increased flu cases. And with the holiday season upon us, a time of increased travel and family get-togethers, not to mention the cold weather forcing people to spend more time indoors, rates of respiratory illness are expected to rise even further. To add to the complexity, nursing homes are grappling with a sharp rise in COVID cases, likely due to the JN.1 variant, which experts believe could be more infectious. In summary, we're witnessing a significant strain on the healthcare system due to the rise of COVID-19 cases, particularly the JN.1 variant, coupled with an increase in flu and RSV cases. The situation is exacerbated by the holiday season and colder weather, which typically result in higher rates of respiratory illness. As we move forward, it's crucial that we continue to monitor these trends and take appropriate precautions to ensure the resilience and effectiveness of our healthcare system.